So in my last video, I received this comment. So here we are. So generally when we talk about DNB versus MD, here are a few of the questions which automatically comes in our mind. Like, is DNB inferior to MD? And even if we say that if MD and DNB are equal, then why do toppers choose MD? What are the pros and cons of DNB? Is DNB really difficult to pass? Hello everyone, welcome to my channel. I am Dr. Ritik Duggad and I have completed my MBBS from Grand Government Medical College, Mumbai, and currently I am pursuing my DNB medicine residency from New Delhi. So I am halfway through my DNB first year residency, so I have a fairly good idea about the pros and cons of DNB. And also I did my MBBS from good government medical college, so I have a fairly good idea of MD also, because I was posted in my final year or internship. So I will try my best to give the fair introduction, pros and cons, and the little doubts and comparisons. So first important point is, what is MD and DNB? Like, what is the real difference between them? So DNB stands for Diplomate of National Board, whereas MD stands for Doctor of Medicine. These both are postgraduate degrees which are provided in our country. The only difference is these both are organized by different organizations. DNB, this degree is awarded by NBE, that is National Board of Examination. DNBs are usually conducted in hospitals, which can be either government, trustee or private, but these are mostly conducted in hospitals. Whereas MD stands for Doctor of Medicine. This degree is awarded by MCI, that is Medical Council of India, and this degree is mostly awarded in universities and government medical colleges. So is DNB inferior to MD? So the answer is no. Ministry of Health and Family Welfare issued a notification stating that DNB are equivalent to MDs and MS. So officially it's equal, but let's be honest, because since we are discussing this topic, it automatically means there is some sort of prejudice against DNB. Otherwise, why would such a question exist? Is DNB inferior to MD? Because there are a lot of people asking such questions on different platforms, like, I'm not getting MD radiology, should I go for MD medicine or DNB radiology? For example, I was in similar situation last year, so my rank was around 5k, so I was not getting good MD medicine seat. So I was also in like similar confusion, like whether or not should I take MD pediatrics or DNB medicine. I'm glad I took DNB medicine. Of course, if you are getting MD or DNB in a similar branch, think yourself, take your time. But I'll be very clear, do not compromise on your branch if you are getting a DNB medicine or any branch. Let's say if you are getting that particular branch which you wanted, even if it is a DNB, do take it. Obviously, like, toppers prefer MD. I would not say toppers prefer MD, because like good DNBs also closes as a really good ranks nowadays. So, but still, like top 500, top 1000 people tend to prefer MD. So there are many reasons to it. Firstly, passing MD exam is comparatively easier than DNB, because MD is conducted within your hospital. The faculty, the internals are sitting there, the faculty already knows you, you are comfortable in that environment, and there is some sort of lenient checking, I would say. Like, come on, we all have been through MBBS vivas and we know that how we have managed to pass all of it. So sometimes, like, it's easier to pass, whereas DNB is conducted centrally, so there's no manipulation, there's no favoritism. The pass percentage is really less because the exam is standardized and like you have to live up to that expectation, and there's no sort of कि चलो एक मार्क्स से पास कर सकते हैं. If you fulfill the criteria of marking system, you will get passed. If you do not fulfill the criteria of marking system, you will not pass. So yeah, passing DNB is difficult and many people take few times. So why would one will himself or herself will put into a position like where the degree which you are supposed to get in 3 years might take you 4 or 5. Second important point about MD is people perception. I know, like, nowadays, especially in corporate hospital, so it definitely does not matter in terms of job opportunities. But if you are trying to set up a private practice, general people, that okay, he's an MD, okay, I'm going to an MD, let me show to an MD. So basically MD is like the commoner word for everything. It's about this specialization. People perception, because MD is far more popular, like every single layman person knows what MD is, like, but many of us don't, many of people in medical field itself do not know what DNB. But if you want to start private practice, in your initial few years it will matter, but of course, like, I think so private practice is up to you, like how you earn the trust of that patient, how you build your image, how you build your brand, because one good appointment can win you that patient for life. especially in medicine. So it's up to you at the end of the day. But yeah, in terms of public perception, MD is a wider known degree in India. So third advantage of MD is like MDs are mostly done in universities and state medical colleges, government medical colleges, where there is a huge patient loads. You get absolute free hand from the first year itself. You can write any medicine in the OPD. You can prescribe any medicine. You can do hit and trial of various medical emergencies. But whereas in DNB, you have to follow all the protocols. And having to manage them in that scenario of so much patient load, of course, gives them a better clinical experience. Of course, these are the pros favoring MD. It's not like these are completely opposite in DNB, whereas there are some facts which are favoring DNB. For example, the main reason I took DNB was like DNB has no bond, and especially if you want to pursue super specialization. So anyway, your journey is so long, and bonds will make it even longer. Another big advantage of DNB is there's a fairly good work-life balance. And second, the work which you are expected to do in DNB is quality work. By quality work, I mean like that in government setup, like JR are supposed to do everything. They are supposed to take the blood sample, they are take it to the lab, collect the report, which takes a lot of effort and majority of their time. Whereas in DNB hospital, you do not have to do all of these things. You just have to write the test which you want to prescribe to the patient, or just add into the investigation list. That's it. So the quality, there's a very good work-life balance, and secondly, you get to do the quality work, and thirdly, you get good enough time to study. A third big advantage of DNB, yes, the exam conducted of DNB exit exam are difficult, but since it is a centrally conducted exam, the standard of exam are really good. So you tend to focus on study. You study a lot in your DNB, and also you get the time to study. And also, since the exams are centralized, so there is no scope for manipulation. So NBE has gained recognition in many countries where DNBs are recognized now, especially in Middle East and Europe. There are many countries which recognize DNB degrees, so which is a good thing. So if you want to practice abroad, definitely DNB acts as an advantage. One big thing which I personally like about DNB is that the job is really satisfying, even as a first year resident, because you give quality care to the patient. So there are enough resources, from be it any investigations, you can conduct it within 24 hours. There are good resources, equipments, technologies, like organization, management. There's a very quality care of patients, so which gives you a satisfaction, because in my internship, I was working in, let's say, as an intern, for the basic requirements of even like sending blood reports to mask, injection, vials, we used to collect it, like हम बैंक में जमा करके रखते थे कि maybe उस दिन मिलेगा नहीं मिलेगा. So these things make it very difficult. And in fact, if you want to work in a corporate hospital, then definitely it's very good, because you get yourself prepared like that, because from your very first year residency, you are managing patients based on protocols and guidelines, so which is actually really followed in corporate sector going further. So that way, in terms of DNB, if you want to practice in a private sector, there is no problem. But coming to if you want to practice in a government college, of course MD are preferred, especially if you want to become especially if you want to get into the teaching job. That's what the aim is. If you are getting into a government sector after completing your education, if you want to become assistant professor, then of course, firstly, though there was clear-cut criteria, like MD was preferred, but now they have made some amendments. Like if a DNB is done from a hospital, more than 500 bedded hospitals, then they can go for teaching job. But otherwise also, so after completing their DNB, they have to do SRship in a government hospital, then they can become eligible. So I was pretty sure from very beginning, I want to become a consultant and become a core, I wanted to become a core consultant. I did not have any interest in being a professor or something like that. So even if you have, so you can do it. But if you have any question regarding DNB or MD or the different courses, do drop it in comment section. I will try my best to answer it. Thank you for watching my video. If you like my video, do like, share and subscribe. Please subscribe. It will mean a lot. Thank you.